Many people with disc injury in the lumbar spine report that when sitting or when getting out of a chair they have more pain. This is because they're losing the protective curve in the low back as they do that, and then as their bottom hits the chair, they load that flexed spine that's already injured and it causes more pain. Likewise, when they get ready to stand up, unknowingly, they launch themselves with momentum with a rounded spine, and then as they stand, their torso's weight is borne on the injured portion of the spine and causes that point of pain that many people know quite well. You can sit and stand without pain by utilizing a box squat type of procedure. This has been described elsewhere on fixyourownback.com in more detail. You can use a hand on your low back to make sure you're maintaining that curve and hinging from your hips rather than your low back as you stand. Make sure you're using your gluteal muscles by pushing your knees out as you're accomplishing this effective standing and squatting maneuver. Another common complaint in those that have disc injury in their low back is that they hurt more when they roll over in bed. This is because they're twisting off of the injured disc, throwing their shoulders and their hips in opposite directions and twisting there like wringing water out of a washcloth. In order to protect your spine while you're doing this roll in bed, you can brace your belly muscles, push into the elbow and the knee that are down against the bed, and then push your braced abdomen all the way over to the other side without twisting in the spine. For some, it helps to imagine a steel bar that attaches the shoulder and the hip on each side, helping to preserve and brace the core. Another common pain complaint in those with disc injuries is getting in and out of a car. Let's pretend we've got a car facing in this direction, and let's combine the two maneuvers we just learned by box squatting in and then bracing the core, keeping the shoulders and hips locked together, and moving the entire torso as a full intact unit to a sitting position. To get out is simply the opposite. Brace the core, keeping the shoulders and the hips together, move the braced torso, brace your core once more, and box squat out of the car with the curve intact in your spine.